Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam. This is COVID-19 pandemic world news. In this presentation, we are going to look at dexamethasone study for COVID-19 patients. As of July 18, 2020, there are more than 14.3 million people who have coronavirus infection all across the globe, with more than 600,000 people who have died and 8.5 million plus who have recovered. The dexamethasone in COVID-19 ICU patients is brought to you by a collaborative work led by Dr. Horby, along with the writing committee. This was published in the online edition of New England Journal of Medicine on July 17, that was yesterday. This was supported by the UK's National Health Service. We're going to explore all the different things that we can learn from this study and how we can apply them in future cases of COVID-19 infection. As we know, patients with COVID-19 have acute respiratory illness involving predominantly the lung tissue, the alveoli, the endothelium, and the destruction of the lung tissue, leading to fluffy infiltrates on the chest X-ray and on CAT scans. When we look at pathologically, we see diffuse alveolar damage, inflammatory infiltrates, microvascular thrombosis, along with elevated inflammatory markers like C-reactive protein, ferritin, interleukin 1, and interleukin 7. Steroids have long been known to exert their anti-inflammatory effects in reducing the amount of inflammation in various conditions. So the purpose of this dexamethasone in COVID-19 patients was to study the positive benefits of the anti-inflammatory effects of dexamethasone in acutely sick COVID-19 patients. So they looked at 11,303 patients. Out of that, they selected 6,425 patients who were eligible for this open label study with dexamethasone given as 6 milligrams for 10 days or a control group. So this 6,425 was divided into 2,104 patients who received dexamethasone, while the other 2/3 served as the control group. The follow-up was pretty good, with better than 95%. And here is the breakdown. The interesting thing is they divided the population into 3 separate categories after learning how these patients were responding. The first category included the group of people who were receiving no oxygen. The second group included patients who only were receiving oxygen in the hospital, and the third group included those patients who were on mechanical ventilation. Then here are the results. In the overall group, there was a reduction in the mortality in the dexamethasone group. We will look at we'll look at actual numbers, and the relative risk 0.83 with a p-value of 0.001. The biggest benefit was found in patients who were on mechanical ventilation already. And here we see a significant, almost greater than 30% benefit in the group treated with dexamethasone compared to the control group. Those patients who were just receiving oxygen also showed improvement in the outcomes when they were treated with dexamethasone compared to the control group. On the contrary, those patients who were not requiring oxygen, those patients who were not on mechanical ventilation, received no benefit whatsoever in this particular study, which emphasizes the fact that dexamethasone is not for every patient walking through the emergency room with a diagnosis of a COVID-19 infection. It is most useful in patients who who require mechanical ventilation, and it is also beneficial in patients who require oxygen, suggesting there is an increased inflammatory process going on in the lungs to reduce the oxygen level. And if you look at from a different perspective, here is the invasive mechanical ventilation group where the benefit was significant compared to those who were on oxygen only. And the entire group, they all had a favorable result with the dexamethasone, with the exception of those patients who were not receiving any oxygen, who did not see any benefit whatsoever by the use of dexamethasone. Okay, here are some secondary outcomes, of which the only one that was significant was those patients who were on oxygen, who were receiving the dexamethasone, had lesser incidence of requiring mechanical ventilation compared to those who were treated with dexamethasone. In conclusion, dexamethasone was found useful in reducing mortality in COVID patients who were receiving oxygen or who were on mechanical ventilation. The maximum benefit was found in patients who were on mechanical ventilation, where they were able to reduce the risk by almost 35%. Let's look at the counterpoints. At the study period, which was between March 19 and June 8, 2020, the overall mortality in the UK was 26% in the ICU patients, and it increased to 37% in those needing mechanical ventilation. However, these numbers seem to be slightly higher than what we have experienced here in the United States based on several different studies. Again, a 23% mortality in the patients who were treated with steroids, namely dexamethasone, seems to be a high percentage in July 2020, when the management of COVID patients has improved vastly. What do you think? What is your opinion? Thank you so much for watching this presentation, and please do subscribe to our YouTube channel and watch other videos on COVID-19 pandemic. I am Dr. Nik Nikam, and please do subscribe to our YouTube channel.